And we begin the interview asking you, tell us about you. Where did you come from? Well, you know, how did you landed in the clinic, and where your family, where your inspiration for working here, everything that you can tell.
Okay, I'm from Seattle, Washington. I went to medical school in New York and college in Boston. And when I was in Boston in college, that was in the late 60s and 70s, and that was a very political time on college campuses. And I was influenced by something called the Somerville Women's Health Collective. And
Can
other
you repeat that? The what?
Somerville Women's Health Collective, who met together about delivering health care to women mainly. They wrote a book called Our Bodies, Ourselves. And I think that that experience in college gave me the idea of working in healthcare and working in community clinics. So I've always wanted, since I decided I'd go to medical school, and that decision came a little later, I wanted to do so in order to work in a community clinic. So that was why I went to medical school. Then I went to medical school in New York, but after graduating came out to California and did my residency in pediatrics in California, and was lucky enough to get a job at La Clinica, a community clinic, upon finishing my residency. It was my first job, and it was a job I wanted. But I was able to get it only because one of the pediatricians here, who has since passed on, was going to Nicaragua, also in a very revolutionary time in Nicaragua. And I was able to fill in for him for 9 months. That was my first opportunity to work at La Clinica. And that was for someone named Jim Idle, who's a very loved pediatrician here for many years. So
He's alive?
No, he passed away several years ago.
Okay.
Yeah. So when I first started working here, I didn't speak Spanish. My orientation was more around working in a community clinic. That's what I wanted to do, to serve people in that capacity. And in California, that was what was happening. And I was lucky enough to move into a clinic that was being set up. And it was very much community-based. The people that worked here then and still work here are from the community. And they were so wonderfully helpful to me, helping me learn Spanish, helping me to learn the customs of people. So it was really I was lucky. And after the 9 months before Jim came back, I continued working here while I was having children, working as a substitute, helping with call. And then finally, about 5 years later, I got a regular position here. And I consider myself lucky and fortunate and honored to have worked at La Clinica so long. So it's been 43 years now.
Wow.
And I time that by the birth of my first child. He was 3 months old when I started here. And it's changed a lot. La Clinica's changed a lot. My job has changed a lot. But what has continued is the community that works here and the community that we serve. Yeah.
Wow. This is more or less the trajectory of your life. Why did you want to study medicine?
Oh, well, like I kind of came into it from being familiar with it because I had medical parents. My father was a surgeon and my mother was a nurse. Yeah.
No.
So it was a familiar world to me. It wasn't what I intended when I first started college. I majored in Far Eastern Studies and graduated in Far Eastern Studies. But when I'm graduating in that field, I realized I really wanted to, having been influenced by Somerville Women's Health Collective and Radical Times, I wanted to more serve the immediate community in a medical capacity seemed to be natural for me, so that's why I went on to medical school.
That's nice.
Yeah.
This is and then you have been only working since you graduated here in a clinic, I understood?
This has been my main job.
Okay.
Yeah.
Okay.
But I have had other work, but at the very beginning, I was working in Kaiser clinics for a while and well baby clinics in Berkeley, things like that. But in Tiburcio Vasquez Health Center, so I'm familiar with other healthcare systems and Children's Hospital and Mount Zion Hospital in San Francisco. But as I say, my desire was always to work in a community clinic, and so I kept here, kept working here. Yeah,
interesting.
Yeah.
There. Well, you said that you have been working in a clinic for
43 years.
43 years. And how did your involvement here in the clinic change with the time?
How did I do it?
The involvement.
How did your work here change through time?
Oh, well, it's changed a lot. The job, I'm a pediatrician, so the job of a pediatrician has changed a lot. The patients we serve has changed. It's largely Spanish speaking still, but as you know, initially it was mainly from people from Mexico. And then in the last 10 years maybe, it's changed to more people from Central America. And now every day we have new patients from Guatemala, Nicaragua, Honduras. That's changed a lot. So the language requirements have changed. And I don't speak Mom, but that has changed. And the job of pediatrician has changed too, because at the beginning there were only 3 of us, so it was harder. And we also went to the hospital to see all our hospitalized patients. Mm-hmm. We were on call, and so there were 3 of us rotating call 24 hours. And we were going to different hospitals then, more difficult hospitals, Highland and then Summit, and now we're lucky enough to be at Alta Bates, but that's all changed over the last 40 years.
How this have been changed?
How did it change?
Mm-hmm.
Well, the decision to go from Highland Hospital, say the county hospital where our mothers delivered, to other hospitals and eventually to Alta Bates was economically based. It was Medi-Cal. Mm-hmm. It was what prenatal Medi-Cal would cover. And initially, I think I may have all the details wrong, but we had no choice but to go to Highland. And Highland was wonderful, but difficult for us as doctors and for the patients and for the staff at Highland. Really, it's a hard place to work. And then we went to Summit, and then Alta Bates has been our wonderful supporter and the easiest place to work.
What is Highland?
Highland is the county hospital in Alameda County. Uh-huh. It's very close to here.
Okay.
Yeah, it serves Alameda County patients. It's
how
very good people there. Yeah, but many years ago it was hard.
I'm saying. How did you? You said we went to Highland
to see newborns.
But how did you manage it? Working here and going to Highland with Summit.
It was kind of crazy. It was hard.
Can you tell a story?
Well, it was hard, but we always wanted to deliver the pediatricians that were here. There were only 3 or 4 of us at the most for many years. Wanted to deliver care that was equivalent to a private practice. So a private practice in this area would go to see their newborn babies. They would go to Children's Hospital to see their children that were sick enough to be admitted, and they would make treatment decisions on them. They would talk to the staff at those hospitals. So we did that also. And we drove between the clinic, our homes, the clinic, and the hospitals. And we didn't have cell phones in those days. And we had pagers, but we couldn't go very far because we had to be near a landline. Yeah.
But tell me one day, one of those days that you had to move. Let's go behind the time.
You want to know?
Yeah.
Okay. So I had 2 little kids at home.
Oh.
I mean, really little. Like, my son was 3 months old when I started here, and then I had a daughter 2 years later. So what we would do is my babysitter had to come to the house at 7 o'clock because there was no child care where I could drop them off at 7 o'clock. And I would have to leave the house to do the rounds when I was on call at Highland and Children's, and then get to clinic by 9 o'clock. And that was really hard. But we did that. That's what we did for many years. That was a day. And then I would get home by, it depends. If I worked a half day, I would get home by 3 or so. If I worked a full day, I wouldn't get home till 6 or 7. Yeah, and then we would be on call for the Children's Hospital admissions. Sometimes I'd have to go into the hospital and see the children at night that were admitted. And then we were around on them the next day. Yeah, that was it. That was for many years. Things got better. And that's why I'm still here, I think, is that things are much better now. They're much more in the hospitals, at both hospitals now. We go to Health of Latinx and we go to Children's Hospital. But actually, we don't go there. In those hospitals, there are hospitalists at Children's that take care of our children, and they communicate really well with us, so we do not have to round on those kids at Children's. And at Health of Latinx, there are neonatologists there all the time to see the really sick babies. So we go in the morning to see the well babies, but we don't have to be on call all night for the sick babies. So things are much better. It's better for the patients, it's better for the staff. Yeah. Yeah.
Yeah. And, okay. This is more or less related, the same question. It's can you share some milestone and challenge you encountered while establishing and expanding the health program of or department in which you work?
Well, I think the challenges were providing the high quality care that we wanted to provide. And I think some of the milestones were that we were able to expand our pediatrician group. San Antonio Health Center became part of La Clinica, or we became part of them. We became sister clinics, and that allowed eventually the hiring of more pediatricians to be in the pool of people that took care of people in the hospital and in the clinic, that more pediatricians. When we made that little merger, that took a long time, but it happened.
Yeah. I wanted to ask, when San Antonio and La Clínica de la Raza merged together, how was this transition?
How was what?
How was the transition?
The transition of the 2 clinics merging.
You know, because you were...
I mean, from a provider's point of view, it was nothing but positive. I mean, we really were happy to have another place that would hire pediatricians that would join our group. And yeah, I'm sure for administration it was painful and difficult and sticky, but we appreciate that it happened. Yeah. No, we want those beautiful stories, positive. We love that. At the beginning of your career, what primary specific type of health issue were prevalent here? I'm summarizing. What issues of disease were prevalent when you begin your career here in the clinic for the children? This one?
But I am going to ask, what issues were prevalent among the population that you serve.
Oh, okay.
Yeah, I kind of.
Okay, yeah. So in pediatrics, the medical issues were, and still are, asthma, obesity, diseases that come from poverty, exposure to stress and violence, inadequate nutrition, that all affects children's health. Currently, I'd say that's all been true from the very beginning. Now, in the last, I'd say, 5 or 10 years, more and more children are being diagnosed with autism, and that's a real challenge, actually, is getting services for those children and getting the diagnosis straight. That's a newer one. I mean, there's always children with autism, I think, since in the last 43 years, of course, but the range of services has changed, and the need to diagnose and the spectrum of autism has changed. So that's been a new challenge and a difference. ADHD is another one. Attention deficit hyperactivity disorder is another thing we are recognizing more and trying to help people with more. But yeah.
Yeah. That will take us to, you were here in your 43 year, you experimented in the first hand the epidemic of HIV in the community.
The what?
HIV/AIDS.
Oh, yeah. Well, children with HIV/AIDS definitely have been in our practice, but we've been lucky to have Children's Hospital infectious disease specialists take those children on. So they would follow them. They would communicate with us, but they would do most of the care.
That means that your practice were basically clinical practice.
Yes.
Did you interact with the community? What is your experience in that regard? When it's an epidemic of HIV, you are the doctor, the mother, the father. How was that interaction with the patient and communities and parents? And
so it wasn't the same for the pediatricians as I think it was for women's clinic, the OBs, and the internal medicine and family practice doctors, because we had Children's Hospital taking care of those children. They were experts at children's. The care is very complicated, and we didn't have that many kids with HIV/AIDS. So we weren't the experts, so we would be happy to have the infectious disease department help us with that. Yeah. So we would interact as needed, but the patients would use their energy to get to the appointments at Children's, not in pediatrics at La Clinica. So it was different for us than I think for the family practitioners.
But to work in those times with the HIV/AIDS have some implication in the change of the practice. The changes of the practice of pediatric here were affected by this epidemic.
Oh yeah, absolutely.
In what sense?
Well, we were always alert to finding children with that condition, so it changed our level of awareness of the situation. It also tightened our bonds with Children's Hospital. In that sense, it did. Yeah.
And you have
and we had staff here. There was a pediatrician in our group. One of the original pediatricians died of AIDS. Yeah, when I first started here, he was wonderful, and he died of AIDS soon after I got here. So it wasn't even known what it was then when I started here. It was not known. It was this mystery disease. People got strange forms of meningitis, strange forms of skin diseases, failure to thrive, things like that, and it didn't have a name. Yeah. We're talking early on. Yeah, we're talking early on. Yeah, so it was kind of recognized over the years that I was here. But as I say, we would be part of that, but we would also lean heavily on Children's Hospital. Children's is not that far away. It's a couple miles. So we would lean heavily on the experts there.
Yeah, because
COVID, we were much more affected directly.
Yeah, we will go there. We will
Okay.
But I mean this question because when I was a student of medicine in Venezuela in the 80s, and we saw for the first time a patient with HIV/AIDS. And then we were doing turns. Before graduates round for all the department. And it was scared. We didn't know.
No, I understand.
We didn't know, and
we didn't know.
That's the experience. Talking to the patient, but talking to the family, the attitude. Sometimes the attitude of the patient were, because they feel stigmatized.
Oh, yeah.
And then you didn't see anything. Like
stigmatized here.
Stigmatization of the patient. They don't come to talk.
As a pediatrician, I didn't. No, the kid. We did not have that many newborns with HIV/AIDS. So I didn't see that maybe as you did. But we did have it, and we didn't know what it was at first, like in Venezuela. Didn't know.
We didn't know, but once everything changed, even increased the fear of treating the patient, not knowing if you will be
absolutely. And I remember long discussions on keeping things private. We had paper charts then, and we were trying to figure out how to keep it all confidential in a patient chart. You wouldn't believe how many meetings we had of the whole medical staff, how to do that so that insurance companies couldn't come and Xerox information about AIDS or HIV in a patient. So it would be in an envelope in the back of the paper chart. All the charting about that issue would be there, and if we wanted to allude to it in the other part of the chart, we had to basically use code language. And then that part of the chart was where that information was kept was confidential. And no one could open that. Insurance companies couldn't open that. So I remember those discussions and that stigma. Yeah, definitely.
Yeah, I remember too. I was working in La Clínica del Pueblo in Washington, D.C. And that was one of the issues. We have all those meetings, and I was fearly because they have a lot of patients with HIV, and they wanted to take, the record of what nationality, sex, and everything, and identify the person with name. And I was fighting fiercely because I was fearing for the patient, the stigma that this can cause, and it was causing a lot of damage in the communities. People who
I'm
know,
sure,
who know that someone have HIV.
I'm sure.
Yeah.
Yes.
And that it didn't occur anything.
All over, worldwide.
Okay. Well, and how about because you have been passing through, like me, some epidemic around. How about H1N1?
H1N1.
No, it was kind of flu. Yeah, it was kind of, it was the same thing. I know because I was one of the first patients that got it in New Mexico, yes.
And when was that?
Oh, my. In the 90s, let me see. I think in 2003 something, because we were in the research.
Are we talking SARS?
I think
no SARS.
2007
H1N1.
No.
2009.
2009.
Yeah, 2009. Yeah.
So
Sorry for my
We
mistakes.
had a different name. It had like the more puppet.
Yeah, it was a flu. No, sport swine flu.
okay, so my interaction with that was mainly around vaccines, because I was a vaccine kind of czar, they used to call me, a long time ago, and there was a lot of desire to have a vaccine to prevent H1N1, and we didn't have enough. I mean, this was a chronic problem every fall about any flu vaccine, and so there was a lot of stress about adults wanting more vaccine than we had to offer. So I do remember that part. Yeah.
Yeah.
Can you tell us a little bit more about the vaccine czar nickname?
Oh, okay. So at one point, I wasn't the vaccine czar. I was just interested.
Okay. So no one was calling you that.
And eventually, they gave me a little more power. But at the beginning, as a pediatrician, that's one of the main things we can do for patients, is for little kids, is give them vaccines. In my mind, that was one of the most important things we could do. So, we tried hard to understand records from other countries, vaccine records, to keep our vaccines administration, at high levels, and we did a really good job. We were lucky to have a very compliant patient population. Patients that came here really they love vaccines, basically. So we were lucky in that. But we were able to get 99% of our children under 3 vaccinated. Over the years, there were many audits, and we did very, very well.
Did you vaccinate the children, with the normal vaccine, like a
childhood vaccines?
Yeah.
Nothing fancy, just your basic childhood vaccines.
Yeah.
But it's, there's a lot of them, and they have to come in a lot, but we did very well. So I was very interested in making that as good as possible, and eventually was able to unite the efforts of many sites of La Clinica, the teen clinic, San Antonio Health Center, our clinic, family practice. We tried to all work together to make sure everybody got enough vaccines, and we were all documenting it correctly and all this. So that's when the vaccine czar thing came in, and we developed a cross-site immunization committee, and it continues, and it's not in my hands anymore, thank goodness, because it's huge now. It's in some very good hands, but it continues, and that started, I would say, 20 years ago, maybe. Yeah, halfway through my career here, maybe. Yeah. I don't remember. But now there is a pediatrician who's in charge of all that, but mostly we have other people from the community that have been trained in all the stuff. Well, they are important, but I'm talking about staff. Who organize the meetings, the cross-site immunization meetings, the world of vaccines. It's huge. As you know, COVID vaccines change all the time, and they're on top of that. And vaccine for children programs, integrating all the documentation into CARE was a big thing, the immunization registry. We had to do that a long time ago. I was part of that. And then now integrating CARE into the electronic record has been a big deal. But thank goodness there have been a lot of people helping with that. Yeah.
Do you have a anecdotic of those times? Anecdote.
An anecdote from that time.
An anecdote from the vaccine time?
Something that happened those times that you will laugh or cry, I don't know. Let's continue. If you don't have it.
I can think of lots of stories, but I'm not sure.
It's something that happened, like you were trying the patient and suddenly something happened that make you laugh or make you worry, and even, sad story. That happen all the time in the hospital, but I related to H1N1.
Yeah. Around H1N1, not so much.
Not so much.
Yeah.
Well, it's okay. Let's go to COVID.
To what?
COVID.
Oh, COVID.
Yeah. How COVID changed your way? What was the experience?
Okay, so COVID coincided with the introduction of our second form of electronic health records. So we were all, it was a bad coincidence, actually, orienting us all to this new electronic records and having COVID here, because we were all learning it with masks on our faces, and and that was hard. That's memorable. We had an electronic health records before that, but they decided it wasn't
good enough,
adequate, so we went from that one to the current one, and so COVID came with the new electronic health records. COVID vaccine wasn't available at first, so we were all like super careful. I mean, people would wear masks until they left the clinic, then they would go home and change clothes before they gave their children hugs. Everybody was always wearing scrubs. There were no like regular clothes anymore. There were plexiglass screens going up all over the place. Patients were isolated from each other and from us. We were doing telehealth. We still do, treating things by telehealth that we weren't used to treating, like ear infections or sinusitis or things, asthma even. We would usually be examining them in person. We'd have to get good at eliciting the history by a description of their symptoms from home and then calling in prescriptions if need be without actually examining them. So we were learning a new set of skills. And then when vaccines came, we were ecstatic, absolutely ecstatic. All the providers took pictures of themselves getting their vaccines because they were all afraid of getting we were all afraid of getting COVID, and many staff did get COVID, but we did. We continued. We survived.
Yeah.
Yeah.
How was one day when you were attending your patient, and you go home, with all those protective equipment, and
Yeah,
how did you? Would you worry about going from La Clínica to your home?
Well, I didn't
children?
have my children.
Yeah.
I've been here 43 years, so my children were adults and out of the house.
Uh-huh.
I didn't have little children at home.
Okay.
Most of the staff had little children at home. So when I went home, all I had to do was wash my hands, change my clothes, and yeah. And my husband's also, he was careful. I still haven't had COVID. I never had the disease. Never.
Wow.
That's impressive.
What?
That's impressive.
It's amazing. I think I have some sort of immunity. Special immunity. I don't get sick very much. I think it's because I'm a pediatrician and see so many sicknesses, and so I've probably been exposed to other coronaviruses that have given me a small amount of immunity that's built up over my career, and I was able to resist COVID, I guess, because I've never had it, and I've tested myself a lot. But anyway, so when I went home, I cleaned up, but I didn't have to do anything extraordinary.
Okay.
Yeah, but it's more in the clinic. It's been hard because wearing masks is hard.
Yeah, all the time.
Wearing masks, speaking Spanish, typing in English on the electronic records, and being a little hard of hearing and trying to understand people while they're wearing a mask. It's been challenging. Yeah.
I can see that.
Yeah.
It's not small.
The masks are the hardest part.
Yeah.
The masks are the hardest
Yeah.
part.
It must be because you are breathing your own not breathing fresh air like it is.
Right. Well, not only that, you and I, when we look at each other, we're looking at our mouths.
Yeah.
We all read lips a little bit, and some of us more than others. And when we have masks on, it makes it hard.
It makes it hard to understand, especially people like me. Like, English is not my first language, as you know.
Oh, it's hard with anybody. It's hard with English speaking. It's hard with Spanish speaking. Yeah.
Yeah. Okay. Thank you for that one. But I wanted also to ask, during COVID, how was your interaction with the other staff, other provider?
During COVID?
Here in the clinic.
Well, some things got better, I have to say, and some things were harder. I mean, it was harder not to be able to meet and to meet in person, see each other, watch each other's reactions to things without masks on. But some things were better, and I'm sure this is true for many fields. Like Zoom meetings were better for some of us, because we could Zoom in, we could hear people, we could see people. It wasn't bad. And we still have a lot of Zoom meetings, which are good, yeah.
Yeah. And, well, this is sort of the same question. Let's see if some of your answers can be more specific. Can you share any personal stories or experience that vividly illustrate the profound and life-changing impact of the health service you work in on individual or family with Latinx communities? And number 8, I try hard. Make me feel like it.
That's a huge question.
It is.
I've been lucky to work at La Clinica because we have a strong administration that's committed to surviving and to serving the community. And it seems to me we've survived by getting bigger. And I don't know if that's been their plan, but it's been the reality. We've developed many clinics. Like you could look at a BART map. We have a clinic on the BART lines. We're in Concord. We're in Antioch. We're in Pittsburgh. Vallejo's not on we're in Vallejo. We're in Alameda County. It's several sites, and a new site just opened. So, and then there's school-based clinics. So it seems to me that I've been lucky to work in a place that survived through all the really racism about not delivering care to immigrants, and it just grows and it accepts the fact that the need is there and they will find a way to do it. I've been working. It seems to me like this agency has learned how to stretch the Medi-Cal dollar. So if a child has Medi-Cal, qualifies for Medi-Cal, somehow the money that we get for the service to that child is enough to help serve maybe the parents who don't have Medi-Cal. Somehow we've stretched the Medi-Cal dollar. Yeah. So I've been lucky. And they also figured out how to become an FQHC clinic and get more reimbursement for the services that we deliver, because we have a wraparound system here where we provide nutrition, social work, all kinds of other services that are required by FQHC
That's
clinics.
really cool.
Yeah, and we were way ahead of we were way ahead of Children's. Children's Hospital didn't have FQHC status for many years after we did.
Can you tell, for the purpose of our recording, what is it?
FQHC. It's just a federally qualified health center.
Okay.
Yeah, that's what we are.
The clinic become federally qualified while you've been here?
Yeah.
What have you noticed in terms of differences
I
aside from
can't.
that, in terms of your ability to
I
care?
think the difference is that we've survived. I mean, I think it's brought in enough on the services that we provide to keep expanding and to not close our doors. I believe there's been clinics that have had to close down before FQHC Stanley because they couldn't afford to go on. Yeah.
Before I forget, I got intrigued. How was your experience at Tiburcio Vasquez? And I think it's different when you were in the San Francisco General, but can you give us an overview?
Tiburcio was when it was before my second child was born, and I wasn't there very long. Mm-hmm. I was there maybe a year, not very long, and it was 1982. And it was a very good clinic. It was very good staff, but it was more challenging for me as a pediatrician because I was the only pediatrician there. And they only had me working very part-time. So getting follow-up for the sick children was difficult. Providing the care that I was used to providing here at La Clínica de la Raza was very hard to deliver there, being the only one there. So I kind of had to leave. I couldn't handle that. Yeah. So it was a good clinic, and I think I know they have grown and they have more staff and they can do it now. But then it was hard.
Well, it was the beginning now.
Yeah, it was very beginning. Yeah, it was only in Union City, and now I believe they're
Castro Valley.
Where?
Is Castro Valley?
When I worked there, it wasn't Castro Valley. Maybe they have a place in Castro Valley now.
No, I don't know. I think I heard for someone that was in Castro Valley, but I'm not sure. Yeah. I haven't been there. We need to go there to do interviews.
To Tiburcio?
Yeah.
Well, it's more than one place. I think there's one at St. Rose Hospital. They took over a pediatric clinic at St. Rose.
Mm-hmm.
Yeah.
Yeah.
But so my experience there was very brief, and I admire the staff, but I was too lonely as a pediatrician there.
Overwhelming with the order. Yeah. And of course, from there you went to San Francisco.
Oh,
when you went to San Francisco General.
No, right after I finished residency, I worked at Mount Zion Hospital. I never worked at San Francisco General.
Okay.
Or Mission Neighborhood Health Center. I worked at Mount Zion in their ambulatory clinic. That's where I trained as a resident for 2 years, so it was easy kind of to be an attending there. Yeah, but that was the only. Then I worked in Berkeley Well Baby Clinics and Kaiser and Vallejo, places like that. But all the time, I was also working at La Clínica.
Okay. Yeah. That's your home.
Yeah. Yeah.
Yeah. Good. How the program? Do you think you working in pediatric have reduced the barriers to healthcare service for Latinx in that time? Or?
I think all of our work here, yeah, not just me, but all of us, yeah, absolutely, yeah.
And do you have an example of this?
Reduce the barriers to getting health care for the Latinx community.
And also for the people, like you see, you attend the mother that came and no once, but...
Yeah. I think so, okay, because we're able to have great continuity with the families. I mean, over the years, I take care of children that I've taken care of, grandchildren. Seriously. So we see them before they start school and fill out their physical forms to getting into school before they start preschool. We help find their preschools. We help them find the right school for them. We help them stay in school because we help treat their asthma or whatever health problems they have. I think healthcare that we provide has been integral to the community of patients that come here. Yeah, absolutely.
Yeah.
We make sure they get their vaccines so they can go to school.
Yeah.
Yeah.
Like let's say a child with autism that come here, do you help them to go to the right institution or what?
We try. That's the hardest. Right now, that's really hard. Because we have to integrate our services with other agencies, with regional center, with agencies that can do the formal diagnosis of autism. It's not easy.
Yeah.
And then we have to coordinate. Once the diagnosis is established, we have to help get some ABA, it's called, and that means working with the insurance agencies. So it can take a long time. It can take a long time.
Which means that it's not a 1 year.
Well, hopefully it's in motion within 1 year.
Okay.
Hopefully, but it does take a long time.
Okay. What are your career's most significant success stories or achievement?
My career's most
Yeah.
significant success or achievement?
Yeah.
I think continuity of care has been what I feel best about. Being able to take care of families over many years, children of children I've taken care of, and so that's what I feel the best about. Yeah, but it's nothing heroic. It's just being there.
Well,
yeah.
I don't know sorry if I'm asking you to repeat yourself, but why did you go into pediatrics specifically?
Why pediatrics? Well, we're talking the 70s, and I didn't want to fight so many battles. As a woman in medicine, being an internist, being an OBGYN, is a whole other level of discrimination, sexism. I didn't want to do that. Being a pediatrician was the fewest battles. The women were most accepted, and I really liked the work. I feel bad that every other doctor can't be a pediatrician. I feel bad for them. It's a great field. But it also came from not wanting to fight yet another battle for acceptance as a doctor.
Yeah. And also, to work with children, that is really,
it's
I
fun.
won't say hard, but it's good, but sometimes children don't recuperate as you want it, and that's hard.
Right.
Yeah.
Right. Yeah.
And last but not the least, Carolina, what do you mean in general to work in La Clínica for all those years? What it means to work for La Clínica all those 43 years?
Well, to me, it's just what I always wanted to do since I graduated college, and it just feels natural. It feels comfortable.
What could be your message for the new generation? Message for the new generation of student, undergraduate that wanted to be a doctor. What?
Yeah.
Because one of them, our main goal is try to.
Well, I think primary care is a wonderful area to go into. Primary care meaning you're not going into subspecialty. I think that's a message that we like to share with the new generation of people wanting to do health care. Primary care as a nurse, as a medical assistant, as a physician, it's very gratifying, primary care, because there is continuity. You get to know families. It's not like working in an emergency room where you see them. You do a great work, but it's much more gratifying to me
circumstantial
to have that continuity. Yeah.
Okay. Well, I think if we're getting. ¿You tienes alguna pregunta? Do you have any question?
Is there anything you feel like we didn't ask you that we should ask you?
No, you asked more than I could imagine.
Well,
There's
I'm
very,
sorry to say
very
that all of these
amazing,
pages,
very
no.
amazing questions.